to ask their questions. And so with your permission, I would like to start today's meeting. My name is Lavia Fuakwa. I'm with the National Development Planning Commission. I'm a principal planning analyst, resource mobilization and partnership officer in Ghana. I'm also a fellow at the Africa Center for Digital Healthcare Policy Research. And I'm going to be your moderator for today. This is our third roundtable that we are going to have. We've had our first and second, and we are happy that you joined us. And so without wasting much time, I'll kindly invite Dr. Adedoyin to give us the formal or official welcome and present the overview of today's roundtable. Doctor is the lead and founder of the center. And so Doctor, you're welcome. Over to you.
Thank you very much, Lavia, for that introduction. Can I just mic check that you can hear me and see me clearly and see my slides as well?
Yes, I can see you. I hope the others can see you too.
Okay, what about my screen? Can you see the slides?
Yes, yeah, we can.
Okay, thank you very much. So welcome everyone to our July 2022 roundtable. The African Center for Digital Health Policy Research was founded in partnership with the Korean Development Institute, School of Public Policy and Management, and we are working on a project to achieve or contribute to the United Nations Sustainable Development Goal 3, which is about good health and well-being. So we hold roundtables, policy SAPs, stakeholder coordination and projects across Africa, not just the sub of the Sahara, but North Africa, West Africa, South Africa, Africa as a whole, the 54 nations in Africa. And we have just one center goal, which is to maximize digital health policies for Africa, considering that not many African countries are yet to have a clear roadmap for the establishment of digital health centers or projects. And so today at this roundtable, we're looking at comprehending or discussing digital health adoption frameworks for Africa, which is actually meant to be in pursuit of the United Nations Sustainable Development Goal 3. And today, we will be looking at this roundtable, particularly focusing on the heartbeat of the UN for in terms of SDG 3. I personally serve as a consultant for the United Nations, looking at the health impact of climate crisis, in particular in the sub-regions. And I've come to realize that there are so many opportunities in this digital health space to actually contribute to mitigating the adverse impact of different health crises we have across the globe. So we know that this UN SDG 3 is for all and at every stage. And so at this roundtable, we're trying to promote this so that not just nations, but also organizations and individuals, of all kinds of disciplines, individuals who come from different backgrounds, from the medical sciences to the lab sciences to the computing, from all spheres can actually work together to enhance the security of life and to secure a healthy well-being for everybody across the globe. And we know that there are opportunities to actually coordinate these human efforts, especially through technology, but also through collaborative efforts. Unfortunately, not many developing countries have that money or that strong institutions to move forward or to have that clear direction in terms of how should we maximize digital health opportunities to actually improve health outcomes in our country or in our region. And we know that there are benefits of technology. There's so many opportunities across sectors. In education, technology does a good job. In politics, in finance, we have a lot, and as well in health. But developing countries seems to be behind. in this stride. So this roundtable, we talk about policies, we talk about how policy making can create the environment. So the purpose of this is we talk to policymakers to sort of create that environment that can help us implement health technologies. And that way, if you have a good environment, you could attract foreign and local investments into the digital health space. And you could also commit international organizations to really look at your sector, to look at your region, to look at your country and say, you know what, we're going to spend more money trying to, support these efforts within this region. So this roundtable will achieve the objectives of highlighting these issues, but not just talk about the issues, but actually think of a way forward. So what is the way forward in terms of what we can do, as a center, but also how we could continue to create conversation around bringing policymakers together, bringing medical doctors together, bringing academics together, policymakers, industry experts, investors together at roundtables to talk about way forward, and to also create that contribution in terms of healthcare transformation, which is at the heart of the United Nations SDG 3. One good thing, one strong a unique attribute of this roundtable is that we draw from different backgrounds. We draw from a diverse range of experts. Our fellows at the center, both senior fellows and research fellows, all work together to try to contribute in terms of our roundtable discussions. So we'll have a holistic overview of the sector, looking at Africa particularly, and present a few adoption frameworks for Africa. And the objectives of this roundtable is very clear. We want to discuss the challenges that influence the digital healthcare space in Africa, but also highlight way forward, as I've said earlier, in terms of what can we do? How can we take this conversation a bit further in terms of digital healthcare investments in Africa? And the outcome of this roundtable, as we've done our first in our premier roundtable, and also in our second roundtable looking at the Gambia. Our first roundtable looking at introducing the digital health, looking at Africa in general, and then our second roundtable looking at Namibia particularly, and our fourth roundtable, which is coming up hopefully in August, which will be looking at the Gambia. I'll talk about that in a minute. But in the end, we're trying to ensure that we are contributing to the conversation in terms of policy efforts. What should we be doing as a continent in terms of taking things forward? So this is the outcome from this roundtable. So please do feel free to contribute, bring up questions, feel free to be part of this conversation, and we'll be happy to, again, put on our website the policy efforts that may arise from this roundtable today. Overall, we know that, again, United Nations Sustainable Development Goal 3 looks at good health and well-being, but not just looking at good health and well-being, but ensuring a healthy lives. And technology can promote a healthy lives. It could make work easy for professionals, but also make life easy for politicians, policymakers, for everybody. So we want to promote well-being, a good health, good well-being for everybody at all stages. And that is why, we are contributing to the conversation here at ACDHPR. We have so many portfolios, so many frameworks. I stumbled on this framework very recently in one of my readings, which was provided by UX Studio 2022, looking at the essential parts of innovation. When you make an innovation, or when you make a stride to try to design a form of innovation, what should you look at? And I'm sharing this slide because I want us to understand the fact that solutions must be co-created in Africa. Co-creations must, innovations, digital health innovations must be co-created. What that means is we do not want to import policies, which is what brings out this center. That's one of the founding motivation for creating this ACDHPR, African Digital Health Policy Research Center, because we do not want to, excuse me, we do not want to import policies, but rather we want to co-create solutions. We want the people who are directly affected to be part of the design of any digital health innovation. So it starts from desirability, that people want a better approach to healthcare delivery. And then, is it viable? Is it feasible? And then that leads to design of any form of innovation. So we'll be sharing this light to everybody just to have an idea. And you could as well Google. I'm not going to talk you through, bore you with all the different aspects of what we are talking about here. But I think it is very important to share that we must co-create our solution in Africa. Africa must, whoever is going to invest in Africa towards digital health adoption, it must be co-created. People must be engaged through surveys, through creating conversations, through setting up adoption frameworks, through adapting existing frameworks to consider unique attributes of Africa or any region you're looking at in Africa, understanding what is unique about these people and creating your technology to capture that uniqueness. And that's what we are after here at the African Center for Digital Health Policy Research. And I just want to end by sharing one of the good things that is happening in the Gambia. In the Gambia, as of this month, there is a stride towards creating a smart immunization. So we know that there are volumes of diseases in Africa, not just in Africa, of course, but since we focus on Africa, but we know there's polio, there's help me here, Lavia, there's polio. When you create what do you call it? Immunization for children. I think there's polio, there's hepatitis, measles. There are loads of immunization you give to kids, not just kids, but when there's there's COVID-19 vaccine, for example, just to make your body to be able to survive the viruses and all of these things. So the Gambia is investing in smart immunization, and I just want you guys to look it up, look at what they are doing. But the good news is that they are co-creating the solution with the people on ground, and this is the first African country to think about smart immunization. And so it's good to know that there are strides, there are efforts, but again, at the center, we want to ensure that we talk about co-creation a lot, significantly, ensuring that people are involved in the solutions that you are presenting. At this point, I'm going to hand over to Lavia, and I'm going to say thank you very much for joining this roundtable. I'm very, very confident that you will learn a lot, and also, not just learn, but actually share your own experiences as well for this roundtable. So thank you very much, everyone, for joining, and I'll hand over to Lavia. Thank you, Lavia. Over to you.
Thank you, Doctor. Thank you for that comprehensive overview of the roundtable and what we do at the African Center for Digital Healthcare Policy Research. That was very insightful. Thank you very much. I just want to remind us all that the high-level political forum on the SDGs is underway. It's ongoing at the UN headquarters in New York. And those of us who want to follow, you can just, follow online. Once again, we are very grateful, Doctor. And so we are going to move on to the presentations. Are you ready? We are going to have our first and second presentation, and after that, we will have our question and answers. And so for our first presentation, I would invite Jesu Tony, who is a member also with the African Center for Digital Healthcare Policy Research, to make a presentation on the digital health adoption framework in Africa. Jesu Tony, over to you.
Thank you very much, Lavia. Thank you, Festus, and thank you everyone listening in today. It's a pleasure to speak with everyone on the topic, digital health frameworks in Nigeria. Please just give me a second while I share my screen. I would like to confirm, can you see my screen now?
Yes, I can see your screen.
Okay, hold on just a second. Can everyone hear me?
Yes, Tony, I can hear you, so I'm very sure.
Yes,
All
we
right,
can.
all right,
Yes, we
all
can.
right, all right. So I'll just move ahead. I'll be speaking again on the topic, the digital health adoption framework in Africa. And being a very practical person, I don't like to be too heavy on the theoretical discussions, but we'll try to be as practical as we can. The concept I'm speaking on is the technology acceptance model. That is, we are trying to see how this can fit into the digital health framework of Africa as it is today. And I hope that the discussions following my presentation will be as participatory as possible as well. So going right into it, let's understand what the technology acceptance model is all about. And here I highlight that it's sort of a theory which seeks to test how the usage of technology is adopted or accepted in any setting. And of course, in this instance, we are focusing on digital health solutions in Africa. So the question is, yes, everybody knows in the theoretical sense that when you use your phones to access a solution, it's faster, it's maybe cheaper to an extent, and it's more easily accessible. I mean, it makes sense that instead of going all the way to a hospital, which could be maybe 2 kilometers or 3 kilometers or even 10 kilometers away from you, having a doctor being able to diagnose you remotely is one of the best solutions. So this is what technology acceptance model is trying to see. It's looking at, okay, if a technology is deployed in the society, how well is such a solution adopted or accepted in that society? And there are important factors which you will consider in answering that question or determining that research, whether technology is easily accepted. And here I highlight some of the factors which we consider, for example, the behavioral features of people in a particular setting, the intentions of people in a particular setting, the perceived ease of use of that technology itself, the effort you put into it in expectations of maybe convenience, and then generally the social influence surrounding that technology solution. As we know, there are instances where some form of technology meets some form of pushback. It's not every form of technology that is popular across the globe today. It may be popular in Asia, while in Africa it's sort of shunned, or it may even be popular in Africa, while in the Americas it's sort of shunned. So this the TAM model helps you look at these key questions and maybe determine how to induce the acceptance of technology. Yeah, so why is considering that model important? We will all agree, or I hope we all agree, that good health, that is a key factor in the development of any society, including Africa and the different societies and communities making up Africa. And I would personally argue that good health is one of the key indicators of a society that has potential. And the theory is easily tested in the fact that individuals who are healthy are the ones who go to work daily, who contribute to the economy. And not to sound cynical, of course, but even when you fall sick, being able to get back on your feet to contribute to society is one of the things we see as an indicator of a growing community. And Africa has a lot of this potential as a continent. The population is roughly estimated at 1.2 plus billion today. We have 54 countries and innumerable communities in that setting itself. And why is digital health important in this context? If, for example, people can access healthcare services more easily, more efficiently, as we have seen technology help areas like finance, if it can be scaled as easily in healthcare provisions, we would see that the potential for it blowing up our development is very high. And let's also look at the numbers a little, just to put some substance into the claims. According to this GSMA, it's an organization that captures mobile subscribers around the globe. They estimate that our mobile service penetration, and what that means is that the number of people that sort of have access to mobile phones or different kind of mobile services are around 46%. And keeping that data in one hand, another data from the World Bank suggests that for each 1,000 people, let's say in a particular village, for every 1,000 person, you have 0.2 physicians. And that roughly means maybe one person, maybe one doctor to 1,000 people. God forbid the day that every 100 person in 1,000 falls sick, and that doctor is expected to provide services across that whole sector. So these two numbers, help us form a little picture around how healthcare services are, number one, important, and how digital health in specific can scale the provision of healthcare services to the African continent. And like I said, the technology acceptance model just seeks to probe the usage of technology and how easily it is accepted in the society as it is today. So to make the discourse more easy, I have picked a case study, which is Nigeria, where I'm currently in. Nigeria is one of the countries in West Africa, and it's made up of roughly 200 million people. So it's a significant populace or case study, as it were. And why is it important? I have been opportune to also study some of the innovations around digital health and healthcare services that are currently being deployed today. And why this is important is because it helps us see how far we have gone, whether those solutions that have been deployed today have been as easily adopted as they are touted to be. So here we highlight that there are different subsectors across the digital health ecosystem. There are, from the point of you being able to even self-diagnose, when you punch in some symptoms, and an app tells you, okay, these are the likely symptoms, what the symptoms look like. I mean, COVID-19 is one of the unique use cases that we see in recent times. 2020, virtually the globe went into a lockdown, and it was not so easy to access consulting doctors and all of that. But in a way, people were able to use applications by verified associations like the NCDC in Nigeria and elsewhere, other organizations like that, and were able to self-diagnose that, okay, I may have COVID, I may need to speak to a doctor. So those are the important ways in which we have seen digital health being tested. But back to my point, there are different subsectors in which it is still being currently deployed today. We have the areas of research, we have pharmaceutical services, pediatric services, obstetric services, mental health care. We have different startups today who allow you to, consult a therapist and, speak about your mental well-being and maybe get recommendations on things to do, maybe if you're facing work pressures and all. So there are startups currently in Nigeria that have focused on this, and we have tried to, capture them into a common database to see what kind of unique ways in which they are deploying technology. And we'll talk about the challenges later on, the challenges that these startups are also facing in deploying those services. But here we have a rough look of the strategies that they are taking on. Some of them are using SMS, just the same way since this is an African audience, I think M-Pesa in Kenya is a unique analogy we can use. M-Pesa is very popular as it has offered sort of mobile money solutions to different Africans all over the continent. And just the way you can maybe punch in a bunch of codes and then you are able to transfer money. Some startups are also using SMS solutions to, render healthcare services to people in, remote areas and even urban areas. And this kind of usage is really innovative because it also takes into context the challenges, the relative challenges of some areas in Africa. So some areas don't have access to internet, unlike places like maybe Lagos City, where I currently am. I can easily access the internet, open an app, download an app, open it, and consult. But then SMS has a way of making more inroads compared to the internet. So it's a really innovative usage of digital innovations around providing healthcare services. Then we have startups that are offering antenatal care, being able to give mothers in remote or rural areas access to services, connecting doctors to doctors or doctors to patients when they need to, cross-reference, and different things like even health insurance. There is a particular interesting solution that I just heard of recently where you can, subscribe to health insurance. Insurance is one of the challenging things in Africa, and there's a joke around in Nigeria that is that you, as an insurance company, you are almost competing with God, because when many Nigerians believe in God in one way or the other, and then they don't even fancy insurance products. But what mobile insurance solutions are doing today is that they are offering these services to regular people in a way that they understand and they accept, and they know that even while they believe in whichever God they believe in, they can still subscribe to insurance services in a way that their health is guaranteed, their good health is guaranteed. So for lack of time, we have broken down some of the startups that we identified. The total number is something around 12 startups, and some of them provide general health services. There are other areas that are not so specific, but we also have research and medicinal services. Then we have pharmacies. These pharmacies are able to, you can order online, you can order a product online, and of course, having given them your official prescriptions, as it were, and get the product to you. And this particularly is helpful for people like me, young people like me who live alone. You are not in a family setting, you are ill and can't make your way down to the pharmacy. You get a prescription from a doctor, a certified doctor, you send it to a pharmacy and it gets delivered to your doorstep. So those are the innovative ways in which we are seeing healthcare services being provided in ways that we did not envisage before. And yes, we have come to the challenges now, and this is where the technology acceptance model, which we spoke of, is important, especially in the area of user challenges. So we have, let me start from attitude and behavior. If a particular population is made up of, people who are not really familiar with technology in one way or the other, we have seen that this is one of the challenges which is facing the acceptance of that technology of digital health solutions in Nigeria. And even the startups confirm this, that there is a lack of general acceptance, the way some of us easily accept using our phones to transfer money. We want to see our doctor. That's essentially some of the attitudinal challenges that these startups are facing. And of course, the next question should be, how do we solve that problem? How do we solve the attitudinal challenges being faced by some of these startups? There is the perceived ease of use as well. So we have, again, it cuts back a little into the pool of people we just considered. Old people, for example, who do not even know how to write their names. Can they use this kind of technologies? How do we design it in a way that the ease of use, accessibility is opened up to them as well? That's one of the problems that digital health rather faces in Nigeria today, and I guess across Africa as well. So as a startup or as a stakeholder or as a regulator, we have to understand these challenges in the context of the technology acceptance model framework, and be able to ask more questions on what to do, the kind of framework to create that would encourage people to, key into these services. Outside an example, when ATMs came into Nigeria, they had this streamlined way of providing services. It was only in the English language. And for a country that, while literacy level is still good, there are a class of people that are still not able to access those services. The solution then became, nowadays you have ATM machines that have a wide range of languages. For example, you have the English, the Hausa, the Yoruba, the Igbo language. So an old person who comes into a new area and would like to still access financial services is able to, or at least such a person is not walled away from such services just because of accessibility issues. So perceived ease of use is one of the questions that stakeholders need to research more into in order to deduce how to provide better digital healthcare services. I would move quickly into some of the infrastructural services as well, or challenges rather. Again, what I've found, at least in the course of research on other sectors, is that sometimes innovations need an enabling environment in order to thrive, because you can only ideate to an extent when you want to innovate. And when, for example, the public you are speaking to is not even accepting or does not even understand the kind of solution you want to provide, it is then you need a comprehensive framework, maybe from the regulators, from governments, that says, okay, we support this and you can operate within this, controlled environment. So that's one of the areas in which Nigeria, again, for example, is starting to look into. And though it's something we have had for a long while now, the National Electronic Health Records Bill is one of the innovations or one of such thriving environments that we are trying to create in Nigeria, which would help startups, other stakeholders, even ordinary people key into digital healthcare services. So because we currently lack this comprehensive policy environment, it's one of the stumbling blocks for startups or in different innovators looking to create solutions in that sector. And of course, again, even while this is a good development, we all see that it was started in 2019. It's still in the workings, and it's been this probably the third year when the bill was introduced. So African countries need to understand that for you to create a booming human capital potential that you can leverage to develop the economy and other areas of society, first of all, we should support those who are building solutions around this. And of course, even after creating the policy environment, financing is also one of the challenges. There are only a few venture capitalists that are willing to even key into healthcare investments. And this is a multifaceted problem. But if we are taking things little by little, governments and other stakeholders need to also look at how investment into the digital healthcare sector should be encouraged. Then user education is another important thing that should be looked into, especially in the context of changing the behavioral patterns of people around healthcare systems in Nigeria. And I've touched on this, the need to create a more tech diverse regulatory environment. What we have found in some of the previous research done is that I think there is some interruption. Okay, so what we have found in some previous research is that because some sectors like the health sector are quite traditional, and when I say traditional, I mean they are streamlined in the brick and mortar way. So because we have done this for so long, the introduction of digital innovations has to sort of fit into that pigeonhole. And the problem with this is that healthcare providers that are using technology, they find themselves working with old tools. Do you get? So there is a need to create, that's why we talk about a tech diverse regulatory framework that will cater for those particular set of people. And when this is done, we would see that acceptance for digital health innovations will become more popular. And I've spoken about the legislative environment as well. And I believe that with all this, the main challenge of acceptance for digital health innovation in Africa can be addressed when stakeholders come together. Currently, as it is, it seems people are just groping around in the dark. And when I say people, I mean the startups that we refer to here. They are groping in the dark, trying to innovate around the old system. So when there's a collaborative effort to drive friendly policies for digital health solutions, we would see that at the end of the day, the potential that we speak of here, the human capital potential, the economic potential would really scale up. Thank you very much for listening. I hope I have not taken too much time, and I'll be looking forward to the discussion as well.
Wow, thank you. Thank you, Tony. I wish we can give you a virtual hand clap. Thank you very much. That was a good one. Indeed, health is wealth. Then I think that we can't look at the challenges to draw us back. That model is a good one. If we are looking at the challenges or the bad side, we will never move forward. Regardless, we need to move on and look at the good side of it. Thank you very much. I'm sure our distinguished participants have comments and questions, but quickly, can we move on to the next presentation? And then after that, we can have our comments and discussions. And so, Korede, if you can hear me, kindly walk us through the challenges of digital healthcare. We are all ears.
Yes, I can hear you.
Okay.
I strongly believe you can hear me too. Can you hear me?
Yes, I can hear you.
Okay, thank you very much. I'll start by saying a very big thank you to the two presenters that have set the course for what will be the conclusion part. Apparently, they've made my job easier for me. So I'll start by saying that my name is Korede Olusonya, and good afternoon, everyone, by the way. My name is Korede Olusonya, and my part of the presentation, let me just try to quickly get my slides on. I want to share my screen right now.
Okay.
Okay, I believe you can all see my screen.
Yes.
Okay. Okay, just a second, please. Okay. So yeah, good afternoon, everyone. My name is Korede Olusonya, and the topic for my part of the presentation is Nigerian healthcare challenges. Nigerian healthcare challenges, the case for healthcare digitization. It's an abridged version of the paper that was recently published on the website for the African Center for Digital Health Policy Research. And as part of my obligation as a research fellow at the center, I've been saddled with the responsibility to come up with the presentation of what the paper is, which is to essentially give a perspective to what the two speakers have said earlier on. Is kind of an example to back up what has been said and the case for adopting digital health in the African space and Nigeria, to be very specific, and in continuance of the SDG goal, which is good health and well-being. Yeah, so basically I'll be walking you through this learning outcomes, where I'll be talking to us about Nigerian healthcare challenges, the institutional responses to Nigeria's healthcare challenges by the different health institutions that we've got, the case for digital interoperability, then technology adoption frameworks, which ties into what the previous speaker focused on. Then finally, I'll talk us through the way forward, which is going to be very brief because I strongly believe that there isn't much to say that hasn't already been said when it comes to healthcare challenges in Africa as a continent. I mean, for a continent that is literally catching up with the rest of the world as regards technology, there isn't much to say that hasn't already been said, because while I was trying to come up with the literary evidence to back up all that I have here, I found out that what was emphasized on in the past is still what has been built on, which makes room for a bit of adjustments to what has been said in the past. So it makes it look as if we're still hammering on the same thing as regards healthcare challenges. So moving on to my next slide. I would start this slide by talking us through what even led to the paper that culminates in this presentation to start with. So I can remember that I reminisced my experience at different healthcare facilities across the country while I was trying to come up with a topic for my publication at the center. Then I came up with three facilities that I've been to, and one is the Federal Medical Center in Ogun State here. The other is the two others are one at the International Institute of Tropical Agriculture, because I was opportunity to work there. Then the last one was at the IOM Lagos, which is an health, I think, a health facility for immigration purposes. So just to relieve us of the boredom of having to recount my experiences from all of those three facilities, what stood out for me was the fact that the waiting time to get things done, especially when it comes to paperwork, you get to a public institution in the healthcare sector of the Nigerian economy, for example, and you want to try to maybe get a test done or have your case file filled up or create a file for you. It takes long for you to get anything done. And you're literally working in circles because you have to get one paper to the other person, and you're moving along in a public institution, for example. But when it comes to all of these healthcare facilities that we can say have fundings from world organizations, institutional bodies, in the institutional bodies that have funds to back them, you get there and there's a virtual infrastructure in place that literally works. You literally have to work with less paperwork, and your information is moving with you as you get to the next point. You don't have to hold any paper. And obviously, to back up what I'm saying, you get to some offices and you speak with some health practitioners in public institutions, and they tell you that That's the way the thing is done there. And they even show you rooms filled with paperwork, and you begin to wonder, what if there is an emergency case, for example, and someone needs to get their health checked as soon as possible so that their lives can get saved, because there are emergency cases of people dying. So if we check the numbers, that was the thinking that led to this paper as I began to come up with the healthcare challenges that we're facing. So to go into the slides, I'm starting from the general to the specific, and I have here that Africa in the 21st century is obviously bedeviled by a host of health challenges that we have faced in the past and we are currently facing. And those challenges range from poor health infrastructure, lack of healthcare personnel, poor hygiene, which accounts for over 9 million deaths, as measured by the World Health Organization. And Nigeria, as one of the leading countries, especially by population, remains at the forefront of the conversation, with over 40% of the population living in poverty-oriented conditions that induce ill health across the country. Now, the major cause for the healthcare challenges which we have experienced thus far it revolves around the age-long ineffective use of scarce resources, low budgetary allocations to the health sector, and data paucity, which is like a major crux for this research, amongst other challenges that we face. Then with the problems and the health challenges that we face out of the way, we have the institutional responses to the healthcare challenges that we face as a country and Africa at large. I have here that the World Health Organization has responded to many of the problems that Africa faces as regards healthcare challenges, which is in support of the 2030 developmental goal, which also ties into our SDG 3. And it hinges on the universal health coverage and the sustainable developmental goals as spelled out by the SDG 3 that the center focuses on. Now, a major solution by the World Health Organization has been the application of ICT as a major field to get the Nigerian healthcare sector to enhance accountability, data collection, and transparency in the allocation of resources in the best possible ways. Now, the World Health Organization actually created an office, which is the World Health Organization Regional Office for Africa, where it provides support to African countries as regards digital health. And of all that 47 countries that have subscribed to this provision from the World Health Organization, 26 out of 47 African countries have advanced strategies. They have strategies in place to support electronic health, e-health in their various countries. Now, moving on, the reports from various presentations and dialogues on health-related matters in the African space, and as it pertains to Nigeria, submits that 26 of the 47 African countries. Okay, that's a continuation. That's another point that I stressed on earlier now. So, but ultimately, the need for, with all of the conversations around healthcare challenges and the provision by the World Health Organization to have countries coming to the fore on health-related matters and to get the continent better, there is the need for electronic health records, which take preeminence in the list of urgent needs required by the healthcare system, because data paucity is a problem. I mean, you need to have like a list or the numbers on the people that have problems, or on the people that have problems, so that you know how to come up with a plan and roll that plan into action, which is basically lacking when it comes to the Nigerian economy or the African continent at large. Now, I have the case for digital interoperability, which ties into my last point from the previous slide. Digital interoperability, just to set a context for what the term means, it addresses the fluidity of health information across selected sectors of the economy. I mean, I don't know, probably we've seen movies of, movies from advanced countries, by the way, where you get to see people suffering from, I think, where you get to see people in accidents, for example, probably they had an accident and almost immediately there are health facilities, ambulances showing up to solve the person's problem. And, just by the click of some button, you get them knowing the blood group of the person to ease transfusion and all of those. But the reverse is the case for most African countries, or should I say Nigeria, where people would literally lose their lives by the roadside for not having all of these infrastructures in place. And why am I stressing this? I'm stressing this because there should at least be a database that identifies different citizens and you can just tell by going on a database to check what someone's blood group is, or whatever you need to solve the person's problem with the click of a button. So that's what digital health interoperability, or getting data as regards the health sector, talks about here. So there are 4 phases through which digital health interoperability can get rolled out. And they include process interoperability, semantic interoperability, and technical interoperability. The 4 phases were talked about in the paper that was published on the center. Now, moving on with the foreign aid from the WOAFRO, the office that was created by the World Health Organization. Challenges such as non-interoperability of digital health with other sectors of the economy, scaling across regions of the nation, and the misappropriation of resources were advanced as obstacles to the growth of the Nigerian healthcare sector in this case. So, and that speaks to the fact that for us to have anything done in the healthcare system, for us to improve it, for us to have the virtual infrastructure, which is basically technology, running, you must at least have the numbers to work with to say that, yes, these are people that I want to care for. It makes the job easier. It makes saving lives easier. Now, Nigeria remains incapacitated from attaining interoperability in its health sector due to their adherence to the same age-long and conventional way of operating the sector. And this problem of data paucity, or not having the infrastructure in place to have your information in an organized manner is not particular to the health sector alone. It's seen across different sectors. Another sector that I know of is the educational sector, where you're literally working with, even with the presence of systems and the virtual infrastructure to get things done, they still prefer the paperwork, which doesn't really make sense and should not be, because obviously with technological gadgets that will do the job of paperwork and papers that you would never eventually have anything to do with, it makes sense to choose the easier way to do that. As a matter of fact, you could even have no reason for gadgets, because there's something called cloud computing, where you could save all of the information that you need on the cloud and have different versions replicated across different spaces, such that if you're not able to access the information in a particular cloud storage, you can access it somewhere else. So, in addition to all of what I've highlighted, like I said, there is a reluctance to move paper-based into e-health system, in addition to other problems like erratic power supply, which basically explains why some of these gadgets or technological appliances or technology generally might not work at some offices because in addition to the problems that we're facing within the Nigerian context, there is the erratic power supply, which if, for example, you're ready to use your system just the same way I do not have lights here, there's the erratic power supply and it might not coincide with the time that you want to work on whatever technological appliances that you've got. That's in addition to political instability and a host of other problems. And that's the successful implementation of policies within the policies regarding digital health. Moving on, I picked this particular slide from the first speaker, and it was to talk about a part that the second speaker, Jesutoni, had talked about, which is basically on digital health adoption framework. So I do not have any. I picked it to just continue to set the course for the rest of the presentation. Now, to talk about technological adoption frameworks, which I feel I wouldn't be spending much time on because Jesutoni had already done justice to most of what we need to know about technological adoption frameworks. There are different frameworks that exist in the literature. There was one. There's the one that Jesutoni hammered on, which is the technology acceptance model. We have UTSWAT. We have TPB, we have diffusion of innovation theory, and basically all of these adoption frameworks talk about the path which you could adopt different technology to any sector. And the technological adoption frameworks do not tie to any particular sector. You could basically adopt them into the health sector. And some of the results from the research that I did showed that there is no one size fits all to adopting any of this framework within the healthcare sector or whatever sector that you want to adopt this technological framework. And for a continent such as the African continent, you cannot say that one particular framework is going to be adoptable for a complex system that's got 54 African countries. So, and what was obtainable from the literature also was the fact that there were different surveys that had to talk about the different kind of model, that comparison between model basically on what could be obtainable for a particular economy, such as the Kenyan economy that I saw in the literature. There wasn't a clear-cut framework for a particular economy because it's kind of dicey to know the framework to use for a particular country, especially when you know that administrations, as regards political administrations, change over time, and what might hold for a particular administration might be different from what the other administration adopts. Moving on, I have that the COVID-19 pandemic generally accelerated technology adoption or modification in the healthcare sector, which has been hammered on by what Jesutoni said. Response areas include community engagement, laboratory systems and infection surveillance, contract tracing, prevention and control. Now, of all the adopted technologies in Africa, and this is by the research that I got from my research, 57.8% were ICT oriented, 25% were 3D printing, and that's for this for the pandemic period. 10.9% went into the robotics field. And of all the countries that had something to do with the adopted technologies in Africa, the countries with the most innovation were ranked as South Africa, Kenya, Nigeria, and Rwanda in that order. So yeah, as far as technology adoption goes in the African continent, there is no one size fits all, which I have said earlier on. One size fits all for the various frameworks, as study shows that surveys must be carried out to see what works for individual countries per time. Now, moving on to the final part, which is the way forward and the solutions, recommendations that was suggested by the paper that was published. I have that the plethora of the healthcare challenges that we face as a nation in Nigeria makes the total reform of healthcare system a matter of topmost priority because of the critical nature of the sector in dealing with human lives, and suggestions to allow for improved digitization of the Nigerian health sector includes: number one, the inclusion of digital health in the educational curriculum of healthcare institutions through courses like ICT for development, health informatics, system designs, and electronic health system across the various arms of educational institutions. And I think I want to emphasize on this and the fact that when you get to some of these healthcare facilities, you have personnel struggling with how to use some of these technological devices or perfectly infuse themselves into technology, which is not meant to be the case. Secondly, there should be the provision of uninterrupted power supply to the Nigerian health sector, since digital technologies / infrastructure rely on electricity. It's important that the electricity sector be further improved so that this trickles down on other leading sectors of the economy, one of which is the health sector. Then lastly, I have that there has to be the provision of standard health equipment that supports digital interoperability with vital sectors of the economy, up-to-date healthcare equipment and facilities to facilitate real-time access to healthcare information and services at the earliest conveniences needed in the Nigerian healthcare system. And yeah, that's all from my side. I want to say a very big thank you to you guys for listening.
Oh, thank you, Tony. That was insightful, and I absolutely agree that as far as technological adoption is concerned in the African continent, there is no one size fits for all. We must come together and find out what best fit our continent. And that's what Dr. Adedoyin has been stressing or reiterating on, that digital healthcare must be co-created. We need to come together and look at what works for us and then implement that, and not just what other countries or other continents are implementing. Thank you very much, Korede. Okay, so we've had two insightful presentations. The floor is now opened for comments. If you want to contribute to the discussion, kindly come in, kindly let us know. We are here to discuss the African healthcare digital space or ecosystem. And okay, there is one question. How has culture affected the establishment of healthcare? Korede and Jesus Tony, please stand by so that you answer our questions for us. I know Dr. Adedoyin is also online to answer some of the questions for us. We will give him the difficult ones to answer. So Doctor, please stand by for the difficult questions so that you answer those ones. So Korede and Jesus Tony, over to you. How has culture affected the establishment of the health system? Okay, I see your hand. Jeffrey, I would call you, sir.
Okay, hi everyone. If I may, that's a very good question, as someone in the chat box also affirmed. And I believe culture speaks to, at least looking at it within the context of the technology acceptance model, it speaks to the behavioral and the behavioral patterns which Africans are known for, or at least some sectors of Africans are known for. And yes, belief is also a part of it, like the belief systems on, okay, whether you can really, for example, a personal bias, maybe speaking from my background, is that some kind of things you don't want to say it over the phone, for example. That's a bias that some people in my local setting have. You can't say some things over the phone, it's unsayable. So you would rather, okay, walk over to the hospital and let the doctor know. And this also affects the adoption of digital health systems, I believe, because if people don't feel safe talking over the phone, even though the confidentiality duty which a healthcare or doctor has while seeing you physically also operates even when they talk with you over the phone. People need to understand this first to be able to even change their outlook towards the adoption of digital health system. Unless we can combat this kind of notions, we would see in a long run that belief systems, cultures really do affect the adoption of, or the establishment or adoption of digital health solutions. I don't know if I got the context of Kibalama well, but I mean, I'll be welcome to receive more clarifications if I did not.
Okay, thank you very much. It's an open discussion. And so even if the participants also have solutions or can answer the question, please go ahead. There was a hand raised up. Jeffrey, are you there?
Yes, I am.
Okay, over to you, sir.
Hello to everyone in this meeting. I want to thank God for having an opportunity to be part of the roundtable discussion this evening. It's an evening because here in Uganda it's now 7 o'clock. So I think it's an evening, yes. I'm so excited about the issues to do with technology. I happen to be a political scientist, currently doing a research in digital transformation in as far as transport is concerned. So now you bring in the element of e-health. One, I want to appreciate the technological processes that have taken place in our mother continent, Africa. I want to appreciate the work of innovators. But the only challenge, if I come in as a political scientist, I want to look at the bigger picture of the security of our countries. Most African states, we are depending on this imported technology. Rarely do we have any state in Africa where we have our homemade technology that we are using to do all this kind of work. Now that we are depending on imported technology, I think there is something what we call reversal innovation. I think African countries, they need to go to that extent of reversal innovation. When we receive this technology from, let's say, Europe, from, let's say, global north, we should think about adjusting this technology to match our needs. One, two, to reverse technology to the extent that we put safeguards against the possibility of hacking, against the possibility of spying on us, because this technology has, in one way or another, been misused by the providers of itself, of the innovators themselves. Because when I am supplying you with technology to manage this meeting, for example, I have the capacity to record all that is taking place in here. So for this reason, there is a need for reversal innovation. And two, somebody talked of political instabilities. You realize that as one way, I think as one of the challenges of e-health, you realize that ever since our countries got what they call independence in quotes. We have always, most especially all African countries, we have tested this kind of unfortunate situation of turbulences in as far as the politics of our land is concerned. So our former colonial masters, also in quotes because they are still here with us, they tend to use some of these things which post-development theorists call post-development projects. And for us as Africans, we want to look at these projects as something very good. And we just take on these projects, we take on these technologies wholesomely, without first looking at the pros and cons. So I would think that as Africa, or as an African, we need to really to cushion these political instabilities. We need to first of all build the strong base, and we minimize the dependence on the colonialists in the name of giving us technology. And then when you talk of the culture, considering my brother Chibarama, I am in Uganda also. I see Chibarama from Uganda. I think we are two of us outside Nigeria. Considering culture is a very big issue. And most people, they have got their cultural settings, the way they are set to go to the hospitals, like he said, like Ajiboye said. Yes, people go to the hospitals and they like cultures, you know. We want to look at this situation when you're in the hospital. I have been in the hospital where the doctor was actually referring on the internet to give me a proper prescription. So I want to look at that as digitization.
Yeah.
So the culture, yes, culture may be there, but what we must appreciate is that we have reached a level whereby our cultural setups are being influenced by these westernized kind of influences. And we have less control over it lately, unfortunately. So I think culture may not stand in the way so much for digitization. The only thing that Africa needs to do is to put the infrastructure. For example, infrastructure. If I am in the deep corner of Uganda, can I access the internet? Can I access the medication? It's a very good thing, but we need to put the safeguards. Thank you very much.
Thank you very much, Jeffrey. You are so right. And that's very, very true. Thank you. Thank you for the contribution. Very much appreciated. Okay, I see a hand up. Estralita. I hope I got the name right.
Yes, good evening, colleagues. My name is Estralita. I'm actually from Zimbabwe, but now I'm based in South Africa. So I'll just first of all like to thank all the presenters for a mind-evoking presentation. It was very articulate. Thank you so much. I have one question for Kirode. I think that's Kirode, ne?
Yeah, correct.
The last presenter. Yes. Okay. In his presentation, he gave us the challenges that Nigeria is facing with regards to this, technology uptake and everything like that. But I feel as if there is a gap that we are missing that Geoffrey is also talking about when it comes to what are we doing as Africans. Are we saying we have to depend on the international community for everything that we are doing? Are we saying that we have to wait for them to develop the technology and then we have to uptake it? Or we have also the capacity as Africans to develop our own technology and then interface it with what is, well, of course, what is coming out from the international committee and all. So that is the first comment from my side. And then the second comment, when I saw the presentations, we are talking about poverty, we are talking about political instability, we are talking about all these problems. Like currently in South Africa, we do not have electricity. We have something that they call load shedding, because the country is failing to provide enough energy to meet our demands. Mm-hmm. So my question is, how then do we sort of like approach these problems that we are facing as Africa from a multi-sectoral view? Because fine, we are having problems in the health sector, but someone is going to say we are also having problems in the education sector. Someone is going to say we are having problems in the transport sector. So how do we merge all these problems and come up with a single solution that is going to what? To sort of like work for, not for everyone, but at least address it from a central position instead of addressing them in a fragmented approach. Apologies for that, it's my baby, sorry. Thank you so much.
Baby is also contributing.
We are parents too.
Baby wants to contribute. Please give him or her a chance. Thank you very much. Thank you very much for your comments and contribution. I wanted to speak about it, but we have another question. How best can we address the issue of digital divide in embracing healthcare? Did I get it right? In addressing health e-care or embracing e-care? If you can kindly clarify, then one of the presenters can take it up and answer. Or if any of the presenters also get what he's trying to say, kindly go ahead. But we need some kind of clarification, please.
I believe the person is referring to digital care when they say e-care.
Is it embracing or addressing?
Addressing.
Addressing. Okay. All right.
And if I did not get that, Kibalama can just confirm.
Okay.
But I guess to speak to it, in case Korede wants to also react, yes, digital divide is a challenge, and I keep making references or trying to draw allusions from the financial sector. So, for example, in the financial sector in Nigeria, there's the problem of okay.
Oh, sorry.
Okay.
I'm just
okay. Kibalama, please go ahead.
Okay. I was pointing out to the issue of digital divide. Of course, some areas being more developed than the other. Issues of accessibility to like electricity, internet costs are so high. So you find that some areas accessing medical care is quite hard because of the differences in accessibility to technology. Thank you.
Thank you. Yes. So I believe we got the context now. And like I was saying, for the financial sector, there has been the problem of the financial inclusion gap. So there are some sect of people who, for example, people who live in cities, they have access to some of this wide range of financial services, which people in rural areas do not have access to. And what, for example, the model we have tried in Nigeria, I'm speaking about finance now, but I'm trying to use it to draw an analogy into the digital health sector. What they've been able to do in the financial sector is that the regulators, which is CBN primarily, and some other operators have been able to devise a way in which people can access financial services by using their SMS, by people who don't even have phones can literally walk up to a mobile money center. I guess the way you have M-Pesa in the eastern region of Africa, Kenya to be specific. So that has been able to a little extent, bridge the gap. And how can we use this, maybe adopt this example in the digital health sector? I mentioned earlier that there are some people who have been able to access healthcare services through SMS. Yeah. And that's just a little bit. And of course, the major improvement in that is that you don't need to have a phone that has internet access. But of course, there are also some accessibility issues, even with SMS. If you don't have the electricity to charge, like Estralita noted. If you don't have the electricity to charge, how do you even use the SMS to access medical healthcare services? So these are the multi-layered challenges that we are highlighting. And like Estralita said, you have to take a broad multi-sector approach when you are solving problems in Africa. Mm-hmm. If you want to aid the access to medical services through SMS, you have to make sure the person has power to even charge their phones to access such. And when they don't have the power, what other alternatives can you give to such a person? We will be looking at things like renewable energy, which some are testing in areas across Nigeria. For example, in the rural areas or underserved areas in Nigeria. Nigeria operates in a general grid, but we're not talking about electricity here. So I'm just trying to cite an example. So the solution which the government has sort of devised is that they try to take solar panels to these underserved areas and, create power. Power is the first stepping block. Once you climb that stage, you move on to, okay, give them phones that at least they can communicate via SMS. When that is achieved, you give them internet, which aids them in providing services and even consulting a wider range of services. So I guess that when we are making discussions like this, would, of course, the stakeholders, including solution providers themselves, need to answer the question that Kibalama has asked, that how do we address accessibility, inclusion when providing solutions to the underserved areas, as it were? I think if Kibalama also has more points to note, or any panelist, they can add. But that's all from me.
Thank you very much for that clarification, because still I was so much concerned about the differences in development that has affected service delivery. So you find that people who are closer to the services like electricity, they can easily communicate, or they make a phone call to the doctor, they are sick. So you find that they can easily access such services compared to people in an area that, because we have very remote areas, even ambulances find it hard to get there. So I'm seeing it as a challenge in Uganda per se, maybe and also in many African countries. Thank you.
Oh, sorry, I was muted all this while and I was talking. Thank you very much. Thank you, Kiba. Thank you so much for your contribution. Is there any other?
Yeah, I would like to add something.
Okay, Jeffrey, go ahead.
Yeah, thank you very much. Here in Uganda, I have heard of... Do you hear me?
I was going to respond to the lady that talked, I think it was Estralita Mpala. Can you hear me?
I think I had been given a platform.
Can you hear me?
All right, I guess it's network lags that is mixing up. Korede Mohaiwe is trying to speak, so I guess you can come after him.
Okay, thank you very much. I had somehow bowed down for that person who was coming in. Yeah, I was talking about smartphones and the apps. These days here, there is a certain platform in Uganda whereby you can go on your smartphone and put in your challenges, health challenges, and then the prescription comes, and then you just walk to the pharmacy, and you may not even need to walk to the pharmacy. You just send a message to the pharmacy, and they deliver the medicine to you at home. Yeah, this is very good. But for me, the danger I am seeing in this, smart or digital health care, it is going to promote self-medication. I don't know, as we go this direction, how are we taking care of this self-medication? Because it's a very big challenge and it may cause some people to lose their lives. Thank you.
Okay, thank you so much. Thank you, Jeffrey. The floor is still opened. Is there any other contribution or questions? You are reminded that all these contributions are going to put together into a policy brief or a policy paper, and then it will be put on our website. So kindly visit our website. I put it in the chat box. www.acdhpr.org. That is the African Center for Digital Healthcare Policy Research.org. Kindly visit our website for future programs or events. There are other things that you can also see there. Okay, I see a hand. Kindly go ahead, please.
Yes, good afternoon.
Good afternoon, madam.
Yeah, I'm also a fellow of the African Center. So I would like to respond to the comments made by, I think, Geoffrey on the issue of e-consultation, and also, I hope you can hear me clearly.
Yes. I mean, Adi, we can hear you.
Okay. So I want to make just response to his comments on e-consultation and prescription. So in places where it is being practiced, that is the e-consult and all that, people do not actually self-medicate, because when you consult with a doctor or follow the e-consult platforms, digital platforms, actually there is a doctor that actually reviews, or a healthcare assistant that actually reviews those things before you can get what to do. And most of the time when they tell you this is what the treatment you have to do, you still have to go to a registered pharmacy to get a prescription for it. You definitely be given the advice on what to do and steps to take. And the drugs that you will be recommended, that will be suggested for you, are actually over-the-counter drugs, which you have to get from the pharmacy and all that. And if it has to be prescription drugs, you have to go to, they will normally send it directly to the pharmacy, or you have to print out something that is signed by a doctor. So that is actually not self-medication. Self-medication normally comes when people just go on the internet, not via the e-consult mode, just maybe when people tend to use Google as their doctors. That's when you see issues of self-medication. Thank you.
Thank you very much, Adi. Thank you so much. Thank you for your contribution. Is there any burning issue, any comments, any questions? The floor is still opened. Okay. We have one in the chat box. The promotion of digital healthcare is great, but what now happens to person-to-person interactions? It has been claimed this person-to-person interaction is primordial to therapy. Yeah, that's true. I remember one of our presenters mentioned that it is actually a challenge. One of the challenges to this digital healthcare space. What then happens to person? Any intervention, any answer to this? What happens? Korede or Jesutoni or doctor can kindly intervene or answer if any, or any of our distinguished participants can answer. We actually had a discussion. Yeah.
Hello.
Hello, Jeff.
Yeah, Jeffrey here.
Jeffrey,
but I think we should not get worried about the digital heresy at the detriment of person interactions, because whereas we have this platform of the digital option, the clinics are still very wide open. The hospitals are still very wide open. You can walk in and get this person interaction. I think there is no problem with that. Maybe what we also need to know is that even when you walk in, the digital heresy, the e-heresy, it's not about getting the medicine on phone or getting the orders from the pharmacy on phone, but it also involves other parameters. For example, when you reach the hospital and somebody wants to give you a prescription, but he's basing on the internet-based kind of study, or he's trying to see the benchmarking on the online. So this one is also looked at as digital heresy. So we should not look at digital heresy as the only way of removing the person-to-person interaction. I think it should be taken in that perspective. Thank you.
Okay. Yeah, that's very true. You are right, Jeffrey. Thank you. Thank you for the contribution. Thank you. The floor is still open. If you have further questions or contribution, additions and subtractions, kindly let us know. Is there any other? Hello, we are getting close to 2 hours. We are still in time. We will be wrapping up very soon. And so I'm giving the floor for comments and contributions if there are any. Yeah, exactly. These solutions should be complementary and they shouldn't entirely wipe away technology. And so exactly, this should be complementary. Is there a hand raised up?
Yes, I did raise my hand.
Oh, okay. Madam Joanne, please go ahead.
I just wanted to add to the last comment about is it that face-to-face interaction will be wiped out? I think this digital healthcare provision will be very good for people managing ailments or a lifelong time disease, whereby you could just wake up in the morning or at night and you're feeling very down and you cannot get your way to the hospital. But I also, my concern is about diagnosis and getting laboratory tests. Will there be provisions in this platform whereby you can be referred to, where you can get tested and also get recommendation or sent the email to whatever platform? Are there mediums going to be provided for such in this digital healthcare provisions?
Okay. And especially for infectious and contagious diseases.
Exactly.
This will be relevant. Yeah. Thank you very much. Thank you for your contribution. Oh, Osman, you do not hear. Can you hear us now?
So I can hear you now.
Oh, okay. All right. Is there any other? We are wrapping up soon. We do not want to take much of your time. If there are no further comments or burning issues or clarifications, we will be wrapping up soon. Okay. So thank you very much. Thank you very, very much for responding to our call. We are grateful to our leader, Dr. Adedoyin, the two presenters, and our distinguished participants, not forgetting senior fellows at the Africa Center for Research Policy, Policy Research, sorry. Thank you all for coming to the call. Thank you for your contributions. As I keep stressing, all these contributions are going to put together into a policy paper. It will be published on our website. Like Dr. Adedoyin mentioned at the start, we are contributing to research or discussions on digital healthcare. And so that's what we are doing. We are going to have our next roundtable. We've had 2 sessions already. This is our 3rd one. The other one we had was looking at the African continent as a whole. We now came down to Namibia. Today we are doing Nigeria. Next month we are going to do another one. We will send invitations to you all once again. We pray, we entreat you all to get us or subscribe to our social media platforms, YouTube, LinkedIn, Instagram, Facebook, and then kindly share when we are online. So we are going to invite you once again for the next roundtable. There's a chat here. Let me just read it out before we. Digital healthcare is set to improve access to healthcare. Technology has improved so many industries, financial, manufacturing, etc. Yeah, that's very true. Technology has helped us to be more efficient and effective. Yeah. So thank you, Adi. That's very true. So if there are no further discussions, may I have your permission to officially close today's roundtable? We are grateful once again. Thank you very much. My name is Lavia and I'm from Ghana. Okay, bye-bye.
Bye-bye. It's been nice meeting you.
Bye, everyone.
Bye, everyone.